This PowerPoint presentation is part of the Level 1 certificate in the Introduction to Health, Social Care and Children and Young People settings run by Plato Training, and it looks at Unit 22, Mental Health. The aims and objectives of this session are you will understand why it is important to recognise and value individuals with mental health problems as a person. You will understand biochemical and psychological mental health conditions and outline factors that might affect a person's mental health state. So we're going to start the session by looking at slides relating to question number 1, and we're going to start by looking at what mental health means. And you'll see here it says a person's condition with regard to their psychological and their emotional well-being. So you need to now click onto the links here of the two YouTube video clips and watch them both, and it's about people living with mental health. So before you move on to the next slide, it's really important that you watch these two videos. So why is it important to recognise and value an individual with mental health problems as a person first? So we need to do this to make the person feel that their feelings and wishes are being respected. Under the Mental Capacity Act, it says that adults with mental health problems should be allowed and encouraged to make as many decisions as they can for themselves. This then promotes their independence. To allow the person with the mental health problem to feel both listened to and in control of their own life. To allow the person with the mental health problems to feel easily understood. It's really important that we focus on the person first and not their mental health problems. The person may feel out of control. We need to allow them to feel listened to and in control of what is happening to them. The person may feel no one is listening to them. We need to allow them to feel listened to. Find out about their needs, their wishes, their likes, their dislikes. We need to get to know them as a person. This will help you to support them. So this brings you to question number 1, and you need to outline why it is important to recognise and value an individual with mental health problems as a person first. We're going to now look at a slide relating to question number 2, and we're going to look at some more of how to use person-centred approach when working with individuals with mental health problems. And I say some more because we know, we've looked at person-centred approach before, and we're focusing it today on the mental health. And it's important that care workers and health professionals gain a thorough understanding of an individual's mental health condition, and this will help them to effectively care for the person's mental health. Care workers and health professionals need to understand that a person with mental health problems often feel worried or anxious about what is happening to them. So they must understand how to care and support the person effectively. They also may need to gain further information about a person's mental health, and this might be by speaking to other health organisations, reviewing personal records or speaking to family members or friends. But it's important that we remember confidentiality rules do apply, thinking about GDPR and data protection. And also care workers and health professionals need to find out about a person's likes, the dislikes, the wishes, needs by asking them the right questions and listening to their answers carefully. And as we've said in the past, it's important to find out as much information as you possibly can so that you can offer the right support for the individual. And question number 2 is asking you to give 4 examples of how to use person-centred approach when working with individuals with mental health problems. You'll see in your workbook you've got a table that you've been provided with, and you will put the example in the left-hand side, and then on the right-hand side in the other boxes how this could help the person with the mental health problems. So remember, it's asking for 4 examples. So the next few slides that you're going to look at relate to questions number 3, 4, 5, 6, 7 and 8. And we're going to look at factors that affect mental health. And you'll see on here, there's a list of factors. So we've got emotional factors, social factors, psychological factors, and physical factors. So you might want to think just for a few moments about those 4 different areas before you move on to the next slide and think about how those factors may affect mental health. So emotional factors are when a person feels very emotional. So this could be due to a bad experience, the death of a loved one, or generally feeling a lack of control in their life. Social factors, so when a person feels isolated, feeling alone, having no friends or unemployment, or unable to go out and socialise due to having lack of funds or no one to go with. Psychological factors, so when a person has a fear of coping with a traumatic situation, such as abuse, they may have a phobia. So for example, they may be scared of leaving the house, bullying, or stress. Physical factors, so when a person has a physical disability, that makes them feel different and worry that people look at them differently. Another risk is a lack of inclusion, so this could be due to the person having mobility aids, so using a wheelchair, and some environments do not have adequate adaptations, so if any at all. So this results in the person with a physical disability now having a mental health disability such as depression. So the next few slides look at mental health problems that can come from some of the factors that we talked about on the slide before. So depression, so this can have an effect on an individual's mood. They may feel sad or they may feel lonely. They may not feel good about themselves. Sometimes an individual with depression may not want to carry out the usual routines. So for example, they might not want to get out of bed. They might not want to see their friends. They just might not want to generally get motivated because they're feeling really low and depressed. So anxiety, and this can make an individual look or feel scared. Sometimes people may have panic attacks, they may feel nervous, and also it can affect their sleep patterns, which can also have a knock-on effect on other areas. If they're not sleeping, they're tired, and then they're feeling more anxious, and then it can just lead to, like say, feeling nervous and having the panic attacks. Another mental health problem is self-harm, and self-harm is when somebody cuts themselves, they hurt themselves or injure themselves, and it's done on purpose, and that's why it's called self-harm, because they're doing it to themselves and they're doing it on purpose. So there's eating disorders also. So this can include overeating, undereating, cutting out entire food groups. So for example, cutting out fats, carbs and sugars, not eating enough to stay healthy and not eating anything at all. So then that can cause anorexia. Another one to look at is stress. So this can involve feeling worried, anxious and tense, being unable to sleep well, no longer enjoying food, no longer eating food, not being able to eat, and overeating. Bipolar disorder. So this is when a person's mood changes between high and low. So an example, so being overexcited versus being very sad and very unhappy. And sometimes people with bipolar behave normally, then at other times they will seem strange. Schizophrenia, so this is when an individual imagines that characters or voices are in the head are real. They may think they are talking to them or telling them to do things. People with schizophrenia will think the characters and voices in their heads can cause danger or harm to others. And this slide relates now to question number 3, and we're looking at biochemical mental health. And this is when chemicals in the brain change how a person thinks and feels. Biochemical mental health disorders include bipolar disorder, postnatal depression, depressive disorders, and anxiety disorders. So bipolar disorder, so a person's mood changes between high and low. So for example, sometimes being overexcited or at other times feeling really sad and unhappy. Sometimes an individual with bipolar disorder will behave normally and at other times their behaviour will seem very strange. Postnatal depression is a type of depression that many parents experience after having a baby. It's a common problem affecting 1 in every 10 women within a year of giving birth, and it can affect partners and fathers too. Depressive disorders. This can affect an individual's mood. They may feel sad or lonely. They may not feel good about themselves, and sometimes an individual with depression may not want to carry out their usual routine. So, for example, will not want to get out of bed in the morning or will not want to spend time with their friends. And anxiety disorders. This can make an individual look or feel scared. Sometimes individuals may have panic attacks, feel nervous, or not be able to sleep well. And question number 3 is asking you to give at least 2 examples of biochemical mental health problems. So think about the slides that we've looked at previously and use those to support your answer. So we're going to look at a slide related to question number 4, and we're looking at psychological mental health. And psychological factors include when a person has a fear of coping with a traumatic situation such as abuse. They may have a phobia, so for example they may be scared of leaving the house, bullying or stress. And question number 4, you need to give at least 2 examples of psychological mental health problems. And as before, use the previous slides to help you to answer your question. So, slide relating to question number 5, we're going to look at stress-related mental health, and there are different mental health problems that are due to stress. So, for example, anxiety is often caused by stress, that causes mental health problems. Depression is often caused by stress, again causing mental health problems, and dementia can be linked with stress also. And question number 5, you need to give at least 2 examples of mental health problems that are due to the effects of stress. Okay, we're looking at slide related to question number 6, which is looking at environmental mental health factors. So this could include space, so having a lack of space. So, if you might live in a small area, a small house, that can affect economic factors, social factors. Social factors are having a massive impact currently with the coronavirus, the COVID-19, because we're not able to socialise, we're not able to see our loved ones, our close family. The weather, whether it could be cold, wet, windy, that can cause isolation and depression. And seasonal affective disorders, sometimes often known as SAD, S-A-D, it's shortened to SAD, and that's where some people prefer the summer months, the lighter nights, the drier days, and when it's wet and cold and dark, it can affect family politics, so having problems within relationships in families, and relational dysfunction. So this is a pattern of feelings, so you might have behaviours towards children, parents, partner, somebody who's close to you that is having an effect on you. And question number 6, you need to give at least 2 examples of environmental mental health problems. Question number 7 is about emotional mental health. So looking at the factors that can affect. So anxiety can cause emotional mental health problems. Depression can cause emotional mental health problems. Bad experiences including death of a loved one, environmental disasters, so bombings, stabbing incidents locally, that's a bad experience that can affect, and experiencing abuse. All these can cause emotional mental health problems. And question number 7, you need to give at least 2 examples of emotional mental health problems. Question number 8 is looking at physical mental health. So physical factors, so when a person has a physical disability, that makes them feel different and worry that people look at them different. Another risk is a lack of inclusion. So due to the person having mobility aids, using a wheelchair, for example, some environments don't have adequate adaptations. So if any of these, it results in the person with a physical disability now having a mental health disability such as depression. And question number 8, you need to give at least 2 examples of physical mental health problems. We're now going to look at slides relating to question number 9, and we're going to just start first thinking about What are the benefits of effective communication on the lives of individuals with mental health problems? So we've looked at communication over the weeks and we know that it's important. So what are the benefits on the lives of individuals with mental health problems? So just think about that before you move over to the next slide. Okay, so here on this slide, there are some of the benefits of effective communication. So the person with mental health problems will feel understood, they'll feel cared for, they'll feel safe and secure and able to express who they are and how they feel. You know, if we're effectively communicating with them, you know, hopefully they'll be able to feel that they can tell us how they're feeling. They'll feel listened to and heard by others. They'll have a feeling of independence. They'll feel valued and respected and part of the community or the environment or the mental health setting where they live. They'll be able to show their emotions, feel less frightened and alone. They'll be more in control of the care, cared for and understood, valued and respected, listened to and heard by others. They'll be able to trust people, so the care staff, the doctors, the nurses who want to help them. So they will, you know, if we communicate effectively, we will be able to gain that trust. They'll feel less scared, afraid, less anxious. They'll feel less alone. They'll feel, you know, no longer isolated. It will help make sense of their own feelings, and they will be able to ask for help if they feel safe and secure. You know, with the effective communication, they will be able to ask for help. They'll be able to show their emotions, not afraid to tell their true feelings, and they'll be able to give opinions of what's working and what's not working. And you know, it's really important that effective communication to build the trust and gain an understanding for somebody to be able to talk to you and you know, express how they're feeling. So this brings you to question number 9, and you need to identify the benefits of effective communication on the lives of individuals with mental health problems. To identify, please ensure you write a benefit followed by a supporting sentence to demonstrate your understanding of each example. And you'll see there's a table where you put the benefit in the left-hand side and then you write your sentence on the right-hand side. So we're now going to look at slides relating to question number 10, and for a few moments I want you to think about active listening skills. Now we have looked at this over the last few weeks, so what are active listening skills and why are they important, or what's the importance of using them with individuals with mental health problems? So think about that for a few minutes before you move on to the next slide. Active listening skills, so these are facial expressions and nodding and smiling appropriately. So if you're having a conversation with somebody, if somebody's talking to you, you're showing them that you're listening. You know, you might not be verbally speaking back to them at that point because they're doing the communicating, but by your expressions, you're nodding and, you know, and you're smiling in the appropriate places, it shows that you're actively listening to that person talking to you. Good eye contact, facing the person who is talking. Again, all active listening skills. Good eye contact, you can see and hear, you know, what that person is talking to you about. Staying focused on what the person is saying and not letting your thoughts wander. Really, really important, because you know, if your mind is wandering, your thoughts are wandering, you're not listening to what that person is saying, so you know, you're not actively listening and you might not be able to answer them once they've stopped talking. Your body language, it needs to be calm and relaxed. No, not sitting too close or too far away from the person, just making yourself so that you can hear, you can see, and they can hear and see you as well. And making helpful comments. So for example, you know, I understand, you know, just making comments within the conversation to show that you do understand and that you are listening. And why it's important to use active listening skills with individuals who have mental health problems is to be able to find out information about the person's mental health issues they're experiencing. You know, if somebody is actually talking to you and telling you how they're how they're feeling and what they're experiencing, it's really important that you do listen. You know, it could be the first time that somebody's actually spoke about how they're feeling, and if you're not listening and not taking it serious, you know, that can really knock somebody's confidence. And this will enable the care worker, the health professionals, to, you know, to get the right treatment, you know, the right care, to treat and care for this person's condition, to point them in the right direction, and to give them the right support to help them. You know, like I say, it might just be the first time somebody's talked to you about it. It might not be, it might be something ongoing, but you know, it's important that you listen and you actively listen, and then you can point them in the right direction and get them the right support to help the individuals. And this brings you to question number 10. You need to outline why it is important to use active listening skills with individuals who have mental health problems. Remember to outline, you need to write in full sentences and develop a paragraph. And there's a little tip there to think about what active listening means and write what your understanding of that is, and then show how the person with mental health problems may feel when this technique is used. And this brings you to the end of this session, and we'll just run through the aims and objectives again. So now you've finished the session, you have an understanding of why it's important to recognise and value individuals with mental health problems as a person. You'll have an understanding of biochemical and psychological mental health conditions, and you'll be able to outline factors that might affect a person's mental health state.